Okay, so first we got to choose our disease, and then after we talked about our disease that we picked with our group members and searched up facts.
And then we collaborated on it to make a visual.
Later on, we start doing the critical friends. That's when
we performed that in front of different groups.
That's when another group basically reviews you, and then they give you back the feedback.
And whoever gets the highest vote out of the groups gets to present in the theater.
And it's going to be very exciting.
My name is Ellie Spear, and today I am going to be your host. Today, with the help of Mr. Delgado's broadcasting classes, we are able to present our Scholar Talks live. We will be broadcasting these from periods 1 to 4, with a few stoppages to transition between different class periods. Over the past couple of weeks in Ms. Freed's anatomy classes, we have been learning about the immune system and how it works on a microscopic and macroscopic point of view. There will be several presentations today on different global viruses and how they attack the human body and how they spread throughout the human body. This period specifically, we'll be talking about polio, hand, foot, and mouth disease, and smallpox. First off, we're going to start off with polio.
Hello, my name is Anthony Delgado, and I am joined with my comrades Jared and Kenny. And well, before we start, you may notice that I'm in a wheelchair. That is because I'm paralyzed, which means I can't move my legs. I can move my arms and my mouth, which is great, but I cannot move my legs. But a quick question is, how many of us play sports in here? Show of hands. Elijah, what sport do you play? Basketball and track. Good. Yanni?
I'm going to do golf this year.
Golf? Nice. Anyone dance? Yeah, a couple dances in here. Okay, great. How many of you walked here to the theater today? Mostly all of you, right? The movement of the body is so crucial that sometimes we take it for granted, and well, sometimes in life we won't know and something like this will happen. But you may be asking, what happened to me? Well, I've been diagnosed with polio, and polio is an infectious disease that affects my central nervous system, meaning my brain, which also affects my spinal cord, meaning it can cause temporary or permanent paralysis. The good news, but also bad news, is I don't die right away, but it is possible I can die because polio might paralyze some of the muscles I use for breathing, which can lead to paralysis of my muscles used for breathing, which can lead to suffocation and leading to death. However, there are a couple good news. Cases of polio have dropped 99%, which is fantastic, meaning polio is a very rare case as of right now. The only issue is there have been some parts around the world, Nigeria and Afghanistan, that have not, that still have polio today. But as you look at the graph, in 1988, many areas are covered in red, meaning those are the places covered with polio. Polio lives there. But now, as you look at 2012, many of those places have been wiped out clean, which is white. Now, like I just said, there are some places around the world that the health organizations around the world are working really hard to try and get rid of this polio disease, but pretty soon, hopefully we will get rid of polio. Now, there are some vaccines. The vaccines also bring good news and bad news. Let's start with the bad news. The bad news of the vaccine can not cure people like me who have polio already, which is the bad news. So there's no cure for me. I just have to keep on living like this. The good news, however, for the vaccines, which Kenny will talk later on in the presentation, is the vaccine prevents polio at a very young age. Polio mainly attacks children at the age of 5. So the recommended vaccines is children's for 2 months, 4 months, all the way up to 4 to 6 years of age. Those doses are very important to prevent polio. Your child, if you use these vaccines, your child will not look like this today in the future. Jared will pass it on to Jared. We will talk about famous people who've had polio and how it damaged their lives and how polio is spread. Jared.
So after looking into all the symptoms of polio, you're probably wondering how you can find it. Well, first of all, you can find polio in the feces of an infected person, and it thrives in unclean or unsanitized places. And polio can be found in infected food, infected water, and through human contact. It is really contagious that you can get infected by polio just by the touch of somebody's hands. And one of the many famous people infected with polio is President FDR. What President FDR was known for is he was a really strong U.S. leader, and he was often in a wheelchair because he was infected with polio. And he would cover his legs because obviously polio affects the legs and muscles in the legs where he couldn't stand up. So he covered it to appear strong to the U.S. And how he got it was he was relaxing on vacation, and he fell overboard into his yacht into infected waters. And then after he got out, he started to feel one of the early signs of polio, which is signs of stiffness in back and neck and pain in back and neck. So what he thought would be a good idea, which really wasn't, was to go back into the water and hopefully it would relieve that pain. But after going back into the water, he came out really worse, where the point was he was really weak in his legs, and his muscles in his legs couldn't help him stand up. And he started to talk to his wife about it, and he went to many doctor's appointments, and all the doctor said was that he just needed a massage, which really didn't help his polio disease. So many months later, he went to another doctor's appointment, and he was diagnosed with polio. This is really rare because children are often diagnosed with polio, not adults. And how's it diagnosed is that there are many signs you can find it by having stiffness in back and neck like President FDR had, and abnormal reflexes and trouble with breathing and swallowing. And doctors will do a laboratory test by checking your stool samples, throat secretions, and cerebral spinal fluid. I'll move on to Kenny.
Before I start, show of hands, how many people have gotten a sleepy foot or sleepy leg? And sometimes you can't feel that leg or foot when you have a sleepy foot or leg. So basically that's what polio is. So polio or poliomyelitis is a crippling and can be deadly, potentially deadly disease. It starts with a virus that spreads to person to person, infecting the human brain and spinal cord. Although there are 2 vaccines that can cure polio, one of them is called IPV. IPV stands for Immunized Polio Vaccine, which is given by a shot from your leg or your arm, depending on your age. And the other one is called OPV, which is Oral Polio Vaccine. It is taken in the mouth, like a liquid, like medicine. And They are both effective, but IPV is the most safest and long-lasting polio vaccine.
In conclusion, it's a very serious disease. But the bottom line is, in the future, if you have a children with family, I really recommend that you use vaccines to prevent polio, because you don't want to see your child like this where I'm at today, in a wheelchair and unable to do any physical activity. Thank you for listening to our presentation.
Great job, Polio. Next up will be smallpox after a smooth transition.
Okay, smallpox, you're up. Okay, ladies, if you can kind of move closer to the screen, so if you could pick up the mic and move over there a little bit. To tell you when you're going.
Okay, my name's Sophia, this is Rowan, Shauna, and Silvana, and we will be discussing the big outlook on smallpox. So, smallpox has been an issue since 10,000 BC, but the last known case was in 1949. But now, luckily, smallpox is eradicated, meaning it's no longer around anymore and it can't affect any more people. So, what even is smallpox? Well, when you have the disease, the first 2 days, no actual symptoms are visible upon the body. But on the third day upon having the infection, it starts affecting your bloodstream, meaning it affects the macrophages of each of your blood cells. And because of the circulatory system and your blood spreading through around your body, it will start affecting all the tissue and killing off the tissue. And then tissue leads to organs, and the organs start dying, and eventually the disease will lead to death. So smallpox has been an issue for a very long time, since BC, and it started in northeastern Africa with the agricultural settlement. And there's always been several outbreaks throughout history up until 1700s, when Edward Jenner found an inoculation process. So what he did is he had 2 young boys, one healthy and one that was sick with cowpox, because he realized cowpox victims weren't getting affected by smallpox. So he transferred some pus from the cowpox boy into the healthy boy, and the kid got sick with cowpox, but then eventually realized that they weren't being affected by smallpox. So that's why we have our vaccines today, where each person is now healthy because of him and inoculation.
So smallpox was such a big issue back then because it was highly contagious, and just by shaking hands with someone could lead you to get infected, and sharing bodily fluids like blood, sweat, saliva could lead to spreading the disease. Sharing needles, sharing drinks, being in the same room as the same person could lead to the spread of the disease as well. And being in the same room as the same person could lead you exposed to the disease, and when the disease breaks out, you would get rashes and welts all over your body, and other conditions consists of having high fevers.
Due to the smallpox vaccine in 1969, naturally occurring smallpox was stopped in the United States. And by 1980, the World Health Assembly declared smallpox eradicated. Now, the vaccine itself uses a virus known as vacina, which is similar to smallpox but not nearly as deadly. What it does is it helps the body create defenses against smallpox in the future. However, its effectiveness depends on how recently the patient was introduced to the virus itself. For instance, if it's introduced before the patient comes in contact with the virus, it may help you avoid the sickness altogether. However, if given, say, 4 to 7 days, you may still get sick. However, you will have a layer of protection against the virus. In most patients who have a healthy immune system, the vaccine is effective and completely safe. However, some patients may have symptoms such as fever, rash, head, and body ache, and with some patients, even worse symptoms. However, historically, the smallpox vaccine has proven to be about 95% successful in avoiding smallpox itself with people who have been administered the smallpox vaccine. As of now, there is no known cure. However, there are some antiviral drugs such as tenofovir, cidofovir, and bendofovir. Tenofovir has been tested with healthy humans as well as animals who have viruses similar to smallpox, and has proven fairly effective as well as being fairly healthy. Cidofovir has been tested with sick animals as well as humans who have viruses similar to smallpox, and has been proven effective. However, the overall effectiveness of these antiviral drugs to smallpox has not yet been proven because it has not been tested with anyone who has smallpox as of yet. In general, it is diagnosed using the signs and symptoms of the patient, which may range from fever, headache, body ache, rashes, and mouth sores, as well as, in some cases, vomiting. You can also diagnose it by separating the virus from blood lesions, as well as spotting antibodies created by the body itself to fight the virus. Of course, all these scientists of course, all these scientists do this in a laboratory where they're kept completely safe as they complete these tests.
Okay, so moving on to some preventions of smallpox. So to prevent smallpox, one way to prevent them is by having good proper hygienes, such as washing your hands, using hand sanitizer, and obviously taking a shower. And another way to prevent smallpox is by avoiding human contact, such as hugging someone or shaking hands with anyone who has contracted the disease, as it is highly contagious and is easily spread. And the last accurate, most effective way to prevent smallpox is by getting vaccinated. And by getting vaccinated, your body will become immune to the disease, so you'll have a less likelihood of contracting the disease. And to wrap up, smallpox is very dangerous and highly contagious. However, early actions do benefit. So thank you for listening.
Well done, smallpox. And now to conclude this period, we will end with hand, foot, and mouth disease.
Hello, my name is Aya Trad, and I'm joined with Audrey, Ashley, and Kim. I spy with my little eyes a skin rash on the hands and feet and painful blisters inside the mouth. What possibly could I be seeing? If you guessed hand, foot, and mouth disease, you're correct. So what exactly is hand, foot, and mouth disease? Hand, foot, and mouth disease, HFMD for short, is a common children's virus causing sores in the mouth and a rash on the hands and feet. HFMD most commonly occurs in infants and children younger than 5 years old. Although the virus is prevalently found in infants and children, it can sometimes also be found in older children such as teens and adults. Symptoms of HFMD typically start 3 to 5 days of being in contact with the virus. First signs of the virus usually include a high fever, sore throat, irritability, and loss of appetite. As the virus continues to progress, symptoms increase and painful blisters can be seen in the mouth. These blisters cause pain when swallowing and dehydration. A skin rash can sometimes also be seen on the hands and feet. The rash looks like bright red dots, sometimes with clear blisters. HFMD is very contagious and is easily spread. The virus spreads through direct contact, such as skin-to-skin contact like handshakes or hugs. It also spreads through airborne respiratory droplets like coughs or achoo, sneezes, and by saliva through kissing or shared drinks. In order to protect yourself from contracting the disease, it is best if you refrain from being in contact with anyone that you think may have it.
There are currently no vaccines available in the United States for this disease. However, there is one available in China known as EV71 vaccine, and it has been used as of December 2015. But it's not necessary to get a vaccine for this disease because there are ways it could be prevented. One way is to wash your hands thoroughly with soap and water for at least 20 seconds because it just to make sure you're clean, and especially if you're changing a diaper, because believe it or not, this disease came and spread through poop. Make sure you clean and disinfect toys and appliances thoroughly if it has been used by someone who has hand, foot, and mouth disease. Make sure you keep your books, toys, clothes, and towels separate. And the last thing you could do is avoid close contact, such as kissing, hugging, sharing cups and utensils with someone who has hand, foot, and mouth disease.
So when it comes to finding a treatment for hand, foot, and mouth disease, there are actually none at the moment for the leaves. However, this disease will clear up on its own within a time span of 7 to 10 days. And this is specifically because this disease isn't as severe in other cases of parts of the world such as Asia. And in order to prevent this disease, you must always have to wash your hands thoroughly enough so that you won't have to inherit the disease. And symptoms like blisters, skin peeling, rashes, or red spots can appear on your body. So you, of course, want to wash your hands always and avoid physical contact with other people who have been infected with the disease.
So some history facts about this disease is that it originally derives from the virus called Coxsackie virus type A16, and it was discovered by two medical doctors that go by the names of Gilbert Daldorf and Grace Sickles in 1948. And fun fact about this disease is that it's originally supposed to be a protective virus against polio, but it just somehow developed into its own disease. And the first reported case was in New Zealand, however it was in 1957, but it can be considered as one of the oldest viral infections because it was mentioned in earlier European hieroglyphs back in 1400 BC. And it's commonly confused with another disease called foot and mouth disease, but the difference between the two is that foot and mouth disease only affects livestock such as cattle or sheep or chickens, and it doesn't infect humans at all. And most cases have been seen occurring in Asian countries such as China or Japan, but however, US doctors have been seeing epidemic occurrences in states like Indiana, Tennessee, South Carolina, and Virginia. An example of those is that around a year ago in August, New New York Mets pitcher Noah Syndergaard contracted this disease while he was at a baseball camp for children, and one of the children probably had the disease, and they high-fived or shook hands or something, and he got the disease from them. And New York Yankees starter J.A. Happ also had the same disease around the same time, which just shows how easily this disease can be attained.
So some facts you guys may want to know is that there have been more than 200,000 cases in the U.S. per year of people who have been affected by hand, foot, and mouth disease. And although this disease is mainly targeted towards people of all ages, it mainly affects infants and children who are under the age of 5. And this is especially risky for them because their immune system hasn't been fully developed just yet to its potential. So of course it's going to be hard for them to fight against this disease since their immune system isn't as strong enough as ours. And also for a fun fact, I myself had hand, foot, and mouth disease as well. And it was hard for me because experiencing this didn't give me the best of days, such as me having to go on my dad's back all the time because I couldn't walk because of all the blisters underneath my foot. So it's just best to always wash your hands thoroughly always, and to avoid those who have been infected with hand, foot, and mouth disease, especially with children, because you don't know what they can always inherit from when touching things.
In conclusion, as we have said many times in this presentation, wash your hands, not just to prevent yourself from contracting hand, foot, mouth disease, but other diseases, and make sure to maintain a good hygiene because it is important, or else you might end up getting sick.
Well done, hand, foot, and mouth disease, and thank you for joining us this period. And thank you for joining us this period and learning a bit more about polio, smallpox, and hand, foot, and mouth. I hope you enjoyed yourselves and learned something new. Please join us next period for HIV, cholera, Zika, and HPV. Thank you, and don't forget to have a great day.